everyone, and welcome back to another insightful episode of MedSynapse podcast series. I'm Hetvi Shah, your host, and today we are delving into a topic that many of us have encountered at some point in our lives, which is acne vulgaris. Though it is common, managing acne effectively is anything but simple. And to guide us through this important topic, we have with us a renowned dermatologist, Dr. Nur Ashikin Ahmad, from Sunway Medical Center in Kuala Lumpur in Malaysia. Dr. Noor specializes in treating various skin conditions, including acne management, and she's here to shed light on the causes, treatment options, and the best practices for managing acne vulgaris. So, welcome, doctor, and it is a pleasure to have you with us.
Yes, likewise, thank you for inviting me to talk about an interesting topic about acne vulgaris.
Thank you, doctor. Now, to start with, let's just start with the basics. So, could you walk us through the pathophysiology of acne vulgaris and what exactly happens at the cellular and hormonal levels that leads to its development?
So, as we know, acne is actually one of the most common skin disease, and almost 85% of people between the age of 12 to 24 years old experience at least acne. It can be a minor or mild acne, or even towards the end of the spectrum, which is the severe acne. So actually it is an inflammation of the pilosebaceous gland. So pilosebaceous gland means, so it is a skin structure that consists of sebaceous gland and hair follicles. So every one of us, our skin, we have sebaceous gland and we have the hair follicles. So what does it do? So sebaceous gland or oil gland, as what we commonly say, it will secrete sebum. Sebum is known as oil. So what does this sebum do? What does this oil do? So oil helps our skin from drying out, okay? And at the same time, the sebaceous gland is connected to the hair follicles, which contain hairs. So sebaceous gland will empty the oil onto the skin surface through the pore. So this is what we call the oil gland, the pore, and the pore has an opening to the hair follicles. So there are four. So how does acne happen? So there are four main contributing factors. One is the excessive productions of oil, excessive sebum productions. So number two, there will be a hyperkeratinization of the pilosebaceous follicles. Keratin is the cells that line the hair follicles. So there will be overproductions, and at the same time, there will be a hyperproliferation of a bacteria, which is what we call Cutibacterium acnes. So this is actually, I would say, a normal microorganism which present on the skin. But in acne, the bacteria will be hyperproliferation. There will be an overgrowth. Okay. So previously, Cutibacterium acnes is known as Propionibacterium. All right. So all these main contributing factors, so there is an interaction, excessive productions of oil. So what does it do? It will block the hair follicles. So the initial lesions, this is what we cannot see by our naked eyes. So it is called as microcomedo. Microcomedo is the primary lesions, is the precursor of all clinical manifestation of acne. So it is basically a plaque which is made up from a collection of the dead skin that line the follicles and with a combination with oil. All right. So when it is located deep into the hair follicles, then there is a hyperproliferation of the bacteria. So bacteria will cause inflammations. So this microcomedon, which is the precursor, will gradually evolve and develop into other acne lesions, which what we call whiteheads, aka closed comedons, open comedons, aka blackheads, And those acne which are inflamed, what we call it as pustules, or even the bigger one, nodules, or it can be cystics. So basically, those are the main underlying cause of acne.
Yes, I think that was a explanation that really simplifies how actually what exactly acne is and what causes this. So I feel it was an amazing explanation. Now, expanding on that only. So, in your opinion, what are the most important environmental or lifestyle factors clinicians should be aware of when treating acne vulgaris today? And because we often hear about things like diet or stress, how it impacts our skin. So, what role do they really play?
So acne is actually it is a chronic condition. It's not just it is combinations of the internal factor, which is our genetics. So genetics play a very big role actually. So if you are born with an oily skin, you are prone to have acne. So how do you know whether or am I going to get acne? Because acne will start in the I would say during secondary school, during teenagers. So I will ask my patient, ask your parents or look at your siblings whether they have clear skin or they have acne skin. So one of the way, because if it's in the family, definitely it is something chronic, because you cannot change your genetics. There's no method to change your gene. Because this is a very important aspect that we need to discuss with our patients to ensure adherence, which we'll be talking about later. All right, so number one is genetics. Look at your parents, your siblings, or your parents. Your parents might not have the acne now because they are already like in their 40s or 50s or even more than that. But you can ask them, do you have acne when you were like 20s, when you are young? Okay, and look at your siblings. So that is number one. Number two, a hormonal factor also play a role. So there will be certain diseases. Let me give you an example, such as polycystic ovarian syndrome. So those who have imbalance in terms of their hormonal, so they can develop acne. Besides acne, they can have menses irregularities, and they can have hirsutism, whereby in a female they have infertility problems, and they can also have hairs, mustache, extra hair. So these are one of the cause of hormonal acne. Okay, so let's talk about external factors. So as we know, external factor, I would like to talk about a few factors. Number one is diet. My patient always asks me, what food should I avoid? What food should I take? So I would like to quote a few studies which they find out that those who consume soft drinks, I think everyone now soft drink is everywhere, bubbles, sweet drink, fruit flavored drinks. If you take more than 7 times per serving per week, and also another diet that can contribute to acne is daily consuming of dark chocolate. So sweetened drinks and dark chocolate. So this food has been shown in study, which shows that it is associated with acne. That's number one. So number two, I always, now patient also ask me, can I smoke, or will smoking make my skin worse? I will tell them, smoking will make your face look older. That's number one. Oh. And you are, okay. And but so far from the study, to assess the relationship between smoking and acne, it is controversial actually. What do I mean by that? Some studies show that those who smoke, they are more prone to have acne. But there's another study that shows that those who smoke, so when we look at the acne lesions, they say it's the same when I start smoking or if I do not smoke. So smoking is controversial. That I say smoke, if you don't smoke, if you smoke, you won't have any. No. smoking will make your skin older. Okay. All right. So another study. Hetvi, do you have your handphone? Do you play your hand? Do you use handphone before you go to sleep?
Yes, I do.
Okay, me too. Because I would like to share with that quite an interesting finding from a study. They show that the short wavelength, the visible light from our handphone, okay? The short wavelength. So from handphones or from smartphone, from a study it shows that it can increase the proliferations of Staphylococcus aureus microorganism. So, but you asked me, but in acne, the usual microorganism responsible is QT bacterium, right? But in a way, they found there is a relationship. When there is increased proliferations of the Staph aureus on the skin in acne, in this population, study population, they find that it might cause an increased incidence of acne. So,
Oh, I didn't know that.
so this is quite interesting. I think most of us have handphones, smartphones, tablets, and we are always exposed to our PCs. So this will be an interesting findings. But sometimes another point is this will give rise to sleep actually. So those who play their handphone before the sleep, usually maybe sometimes we are carried away or it's already 11. So when we look at our phone, we go through all the social media, we ended up at 2 a.m. So it will lead to another factor, which is sleep. Okay, sleep is another factor. All right, so basically everyone knows good sleep is very essential. But from a study that shows that if you sleep less than 5 hours, you tend to have a dry skin. So this is what we call a loss of the transepidermal water loss. So in a way, it will weaken your skin barrier, meaning that when you're exposed to the sun, when you're exposed to the heat, to the air pollution, your skin will react badly. So poor sleep, poor quality of skin, you might have acne. So what is a good period of, the duration for sleep is, from this study, it shows that 7 to 9 hours. So remember, number one, don't play with your phone before you go to sleep, or you have to have a screen off. Okay, I will advise that to myself as well. So and then so you have to have a good sleep. Okay, and another factor will be the psychological factor. Okay, stress. Okay, so I think whenever that we have during my med school, so when we we have our end of semester break exams, we tend to have acne breakout because stress somehow it is related to the stress hormone related to androgen that can make our skin more sensitive to the hormone, so it will cause more sebum productions. So that is the one of the explanations regarding stress. Those who have higher stress level are prone to have acne. Okay, so I believe that this is a very crucial because those who are managing acne. So these are few examples of various factors. Remember, internal and external factors. So we need to consider this factor. We need to address these factors because we are offering a more comprehensive and personalized approach.
Yes, that was actually a really valuable insight, I would say. And I think it is like a holistic approach, like different factors play a major role for your skin.
All right, correct.
Now, moving on to treatments, has been a lot of buzz about the advancement in acne treatments, especially with the social media. You get each day new different acne treatments. So, could you share with us some of the most recent pharmacological advancements? And are there any new topical agents or systematic therapies that are showing promising results?
Okay, so first I would like to give an overview. So acne treatments, when we want to treat acne, we must know how bad is the acne. So basically it falls into three categories: mild, moderate, and severe. So for mild, basically the treatment will be topicals. For moderate and severe, the treatment will comprise of combination. So combination of topical and also pill, systemic. So because sometimes patients have very bad acne, moderate acne, but they go for cosmeceuticals, things that they heard or they look that they come across through social media. Then they just treat themselves with topical, which is not enough actually, because the more you wait for to get a professional opinion, management, so your acne might become worse. And acne, if you develop pustule papular inflammatory acne, there is a risk of scars. Okay, so what are the most common topical treatment for acne? Basically, is anti-inflammatory and topical antibiotics. So number one, as I mentioned before, the precursor of acne is microcomedone. So we want to open up the pores. We want to prevent the formation of sebum plaque, inflammations of the pilosebaceous gland. So number one is topical retinoids. I believe every dermatologist there will suggest topical retinoid as our, I would say, is a must. Okay, so if you look at TikTok, you look at all the advertisement, they will mention retinoid. So the retinoids that you saw in or you purchased from the pharmacy or from the cosmeceutical company, this is we consider as cosmetics. It is not strong enough for it to be used as treatment. So for treatment, topical retinoid you must get, which is a medical grade. Okay, so retinoid, there are so many retinoid. I will mention a few classes like tretinoin, adapalene, tazarotene, but the latest one is trifarotene. So that is the latest one. So what is special about that? I believe all retinol, somehow it will reduce the formation of comedone, which is very good, but it has its own side effect. So it tends to cause dryness of the skin. So what is latest, the extra point for trifarotene is that it acts very selectively on the retinoid acid receptors. Okay, so there are so many retinoid receptors, but this topical retinoid acts specific to these delta receptors. So what does it mean? Because these are the most common, 90% of the skin receptors is RAR delta. Okay, so when it is very specific, so now we know it will work, and then it will have less side effects. Okay, so this is what we want. We want a good improvement. We want an efficacious topical, but at the same time with low side effect. So besides reducing the active acne lesions, it has been shown that it reduces the acne scar as well, as early as 2 weeks. Okay, compared with the vehicle, it compares with other vehicles, but it didn't compare with other topical retinoids. The side effect of it, same as other retinoids, such as erythema, dryness, but these side effects are mild to moderate, and it is tolerable most of the time. So that is with regards to the latest topical treatment. How about oral treatment? So oral treatment, besides mainly we want to reduce the inflammation, so we use oral antibiotics. So there are many oral antibiotics that are available to treat acne. One of it is tetracycline and also macrolide. I will name a few. So the most common, I would say, most of us, we will start with antibiotics such as doxycycline. However, certain antibiotic has been shown to have more resistant rates compared with the other. So more resistant rates meaning it might not be effective for acne treatment. So the latest systemic therapy is sarecycline, which is the oral antibiotic. So what is the special about sarecycline? It has a narrow spectrum, meaning that it specifically targets the Cutibacterium acne, and it is approved. And versus the current, what is available now is I can name a doxycycline, which is broad spectrum antibiotics. So broad spectrum antibiotic is target a wide range of bacteria, So there's a risk of resistance, high risk of resistance, and it's prone to have more side effects. Okay, and sarecycline is effective for inflammatory acne lesions from the study, inflammatory and also non-nodular. And it has less side effect compared with doxy, such as sun sensitivity. So those who are taking tetracycline antibiotics for acne, one of the most common side effect will be sun sensitive. When they go out to the sun, they find that the skin is very, very red. So this has been shown that by the usage of sarecycline, the risk is low. The risk of sun sensitivity is low. Okay, so these two are the latest development in terms of the systemic and also topical therapy in acne.
Yeah, I think these newer option sounds
Yeah.
actually a game
Yeah.
changer for many patients. And especially it is so good to see that these advancements offer more targeted solutions specifically
Sure.
to your issues. So
Mhm.
now the next question is, very relevant to antibiotic resistance. So it is
Sure.
growing, it is a growing concern, especially when it comes to acne management. So how do you approach balancing the use of oral and topical antibiotics? And are there any effective alternatives for dealing with resistant cases?
So antimicrobial resistance, it is a very important issue because I can quote a study, a statistic that shows that antimicrobial resistant infections cause one death every 50 minutes. This is very serious, and the antimicrobial resistance, it is one of the public health concern in the 21st century. So why we need to address this? Because number one, if you give antibiotic that has higher risk of resistance, when you treat your acne, the treatment will fail. Okay, so it is not only harmful at the level of the skin; it also induces the pathogens which is systemic. So sometimes when you have URTI, you have other infection, fever, all that. Sometimes you might also develop antibiotic resistance. So how does an antibiotic resistance develop? Number one, overuse of the topical or systemic antibiotic. I give you an example. So let's say a person have comedone acne. A topical antibiotic is not a good choice because it doesn't act on comedone. So comedone usually retinoids, and the long treatment course used for acne. So usually for oral antibiotic for acne, we limit 3 to 6 months. Depends on the guidelines that you adhere. So longer than that, definitely it will. This patient might develop antibiotic resistance later on. And sometimes there is a overusage of prescriptions or over-the-counter antibiotics, which is prescribed, which is not being monitored properly. Okay, so how do we deal with that? Okay, number one, as a physician, we need to see the type of acne that we are managing, whether this is purely comedonal or a combination of comedonal and inflammatory. So if there is a comedonal, do not start topical antibiotic, it won't work. Okay. Number two, limit the antibiotic durations. The most I would say 3 months. 3 months, if the patient doesn't have a good result, so I will change to oral retinoids, which we have to assess the patient thoroughly. And then avoid topical antibiotics as monotherapy. You cannot give topical antibiotic alone. So you have to combine with retinoids. Okay. So another alternative for non-antibiotic is actually benzoyl peroxide. So benzoyl peroxide topical therapy has been shown to have a good bactericidal effect in those who already have antibiotic resistance, or if they are susceptible to Cutibacterial acnes, it also has a good efficacy. So in terms of systemic non-antibiotic treatment, what are the choice? What are the other examples? Will be isotretinoin or also combined oral contraceptive. But isotretinoin is not suitable for those who are planning to get children because of the teratogenic effect. So these issues, planning to get pregnant, all that, this issue must be discussed thoroughly with our patient. And COC, I will consider that if this patient they want to they want to also plan their family. So COC And isotretinoin is another alternative for antibiotics.
Absolutely, I know. I think that is a good explanation that you've given me. Now, let's just shift towards something which is actually very important and equally important in managing acne is acne scars. So, acne scarring is often a long-lasting concern for many patients. So, could you share with us the current best practices in scar management, including some of the more innovative approaches like microneedling, chemical peels, or laser treatments?
Okay, so acne scar. So acne scar, if those physician who wants to treat acne scar, so you have to know which type of acne scar that you are treating. So mainly, I will divide into three. So you have to assess whether this is a macular acne scars. So macular acne scar, these are the scars which are flat. So it can be hyperpigmented, which is brownish or dark. Those who are in skin types 4 and above, Asian. So this is what we call hyperpigmented acne scars. That's one type of scar under macular. So another type of scar will be post-erythema acne scar, which is red. This is common in those who have fair skin. So how do I treat macular acne scars? So the treatment is actually the same as how we treat active acne, which is topical retinoids. So topical retinoids will help to brighten up these scars. Okay. Number 2 is atrophic scar. So atrophic scar, there are 3 types, which is the box scar. So it is quite a deep scar with a punch out edge, and another one is the shallow one, and the third one is the ice pick scars. So these scars, we need to combine. Okay, so we need to combine with topical and also our we call ablative treatment or even chemical pills. So I give an example. If you assess a patient, so let's say this patient this patient will have all type of scar together. They won't have one type of scar usually. So that's why you have to combine the treatment. Okay, so a patient can have ice pick scar. The patient can also have a macular hyperpigmented scars, and also a deep box scars. So in this patient, I will consider a topical retinoids, and then I will go for the TCA cross, which is a peel, a very, very deep peel for the ice pick scar. And then after that, I will consider doing a resurfacing. Resurfacing, the most effective I find it is the ablative CO2 laser scar. So this will be multi-modalities. So I would not say, this modalities, laser is good for you, because there will be never one type of scar in a patient. Okay, and the last one is the hypertrophic, and it might be keloid scar. So keloid scar, hypertrophic, so far we have there has been research being done about which modality works the best. So far, we have not found any modalities which is superior to another. But most of the time, my keloid patient, acne scar, post-acne, I will go for intralesional triamcinolone. Okay,
I think
so
it
these
is
are, I think, about a general overview of a treatment of acne scarring.
Yeah, I think it is incredible to hear, and I think these treatments actually so differ from the actual active acne also sometimes.
Yeah. Correct.
So now on to something, let's just ask something about that is often goes overlooked in a treatment plan. So one of the biggest challenges in acne treatment, I think, is patient compliance. So what strategies do you find most effective in educating patients and ensuring long-term adherence to their treatment plans, especially, when result takes such a long time for acne sometimes?
So adherence is very important. I believe in chronic condition. So acne is chronic condition. It's not something that I treat you for 1 month, it will go away. No, so because it is genetic, it is in the blood, it is in the, you have the family history. So it is very important for us to have a good relationship actually with our patients. But before I go into their educations, but when during the consultation, we must know what are the factors that can affect compliance. Okay, so sometimes even before you start the medication, even before you say that okay, you have to take this medication, there are several things that you need to consider. Number one is the physician, you and your patient relationship. So you must establish that if the patient doesn't like you, whatever they say, whatever they advise to you, even though you are the best dermatologist in the world, they won't listen to you, because you have to have this good relationship. You must get their trust. Okay, so this trust is not something that short term. It's not something that you can develop between 5 to 10 minutes of consultation. It will take time. You need to invest. You have to be a good listener and let the patient talk, but not too long. So give them ample time for them to talk. Okay, because a good patient physician relationship will bring you all the way. The patient will listen to you. And then number two is if they are lack of knowledge. So you have to tell them acne is something chronic. I cannot treat you 1 or 2 weeks. You need to take this medication for a long time. You have to understand that. Then you have to tell them about the side effect. You have to tell them about the side effect. Sometimes before they come to you, they know, oh, retinol is not good. Isotretinoin will harm my ovary. So you have to tell them the correct information. Okay, so that is before you prescribe the medication. So once you have started the medication, you have to think about, you have to tell the patient how will it work, how long will you expect the results. So as we know, antibiotics, oral treatment, all that, it will take time for it to work. Give it like 2 to 3 weeks. You will start to see your improvement. So usually I will take a picture on the day of examination, the first consult, and then I will take another 1 month and consecutively. So I will show to them. So in a sense, it will motivate the patients to continue with the treatment. So if the patient, again, during the follow-up, you have to be a good listener, ask about the side effect. Okay, because the moment that they have side effect, you have to address their side effects. Okay, so in terms of education, you have to understand, we need to educate most of the patients. They would like something treatment that individualized. So you have to, sometimes you have to tailor your regimen, your treatment according to the patient lifestyle. Okay, so if it's a student, they are very, on the move. So they want something which is I apply and then I go to class, I go to college. So I want something very quick. So you have to use, because you have to add on your personal care advice, all that. So you have to offer them something that they can apply easily, like BD dosing or OD dosing, and you have to reduce the complexity of the treatment regimen. So always also one of the tips that I can share. So let's say they have to take antibiotics, educating about antibiotics. Remember to avoid resistance. Let's say antibiotic 2 times per day. So I will ask them, take in the morning. You must make sure that there will be a stock of your antibiotics on your breakfast table, and one before you go to sleep. So in a way, we have to educate our patient, and we have to incorporate how do they take the medication in their lifestyle. So you have to ask about their lifestyle as well. So this is how I go about in terms of education. So you can also send reminders. So sometimes, let me give you an example, education of incorporating personal care, treatment, and also medication. So they have their cleansers, they have their serum, moisturizers. So I will write down. So in the morning, this is how you should apply in layers. And when should you apply your benzoyl peroxide, and when you should apply your topical retinoids. So in a way, sometimes because when they come to us, there are so many information. So believe me, they will only absorb 10%. So like you will be talking like 15 minutes, they will remember only 10%, the first 1 minute, the first 2 minutes maybe. So you have to write it down. And we have a lot of, way of communicating. We have WhatsApp. So sometimes I will ask them to write down any question that would like to ask me, just write down. I will try to answer their questions. So
Yes,
remember, the patient must love you to listen to you.
that is so rightly said. And I
Yes.
think patient-doctor relationship is also
Yes.
very important,
Correct.
as you mentioned in the beginning. And
Correct.
right kind of communication to the patient is right, because they are trusting the doctor so much. So the kind of communication they have is should be real, I feel.
Correct.
So, Dr. Noor, thank you so much for sharing your expertise with us as we conclude this session today.
Okay.
And this conversation has been incredibly enlightening for me, and I'm sure our listeners would gain a lot from this today.
Thank you for having me as well.
Thank you so much. And to our listeners, thank you for tuning into this episode of MedSynapse podcast series. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource. It's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay aware and take care of it.